Welcome to Thinking Green. I'm Rana, and in keeping with the theme that we've had since after the elections, and which will be continuing till the end of the year, we're focusing on nonprofit organizations. This is the season for giving. Most of us, certainly myself, have plenty of stuff. But there are so many things that we all can do to help this holiday season for people who don't have enough. So with that in mind, tonight I'm welcoming a couple of women who work for Safe Futures, Emma Palzere-Rae and Melva O'Neill. And we're going to talk about the work that Safe Futures does. So welcome.
Thank you, Rona.
Thanks for having us.
Well, I'm glad to have you. I guess I'll start out asking each of you to tell me how you got involved with Safe Futures and what your roles are there. Either one.
I'll start if you want me to. So I am Community Engagement Coordinator at Safe Futures. And my role at the agency is to do outreach and education, whether it be creating an awareness event so that people are more educated about the fact that domestic violence does happen in their community and what they can do about it and how it affects everyone, or whether it's going into a behavioral health specialist office and helping them to better understand how a victim might respond to domestic violence or sexual assault. On top of that, I am also the volunteer coordinator, which plays a huge role in the work that we do, because without our volunteers, we would not be able to reach as many people that we do every year, which is between 5,000 and 6,000 individuals every year. So without those volunteers, we would definitely not be able to give them as much attention as we are able to give them. So,
what about you?
I'm the Director of Development and Communications at Safe Futures, and I've been with them for 6 years. I am responsible for fundraising from individuals, running events, all that kind of thing. I also oversaw our name change and rebranding from Women's Center of Southeastern Connecticut to Safe Futures, and deal with our external communications, newsletters, all that kind of, our social media, all that kind of thing. So.
Well, since you mentioned it, I did want to talk about the mission, and the name change seems to be more than just a name change. So maybe you want to talk about how the mission might have shifted and what the...
we gave a lot of serious thought beforehand to whether or not we needed to change our identity and what direction we should go in. When we went from Women's Center to Safe Futures, in fact, our mission didn't change, which is to save lives, restore hope, and change the future for those impacted by domestic violence and sexual assault in southeastern Connecticut. But we did a good assessment and realized, our name as Women's Center could be a barrier to people getting services. So we really needed a name that caught us up with the times and better reflected everybody we served and all the programs and services we have. Because a lot of people thought of us as serving only women. And I think that picture of women in their head was, older woman with, already married with kids, excluding kind of teen dating violence situations, young adults who maybe weren't married but in a partnership, and without children yet, or men who are also being abused, and and also to have something visionary for how we see our goals here in the community.
Now, have you noticed a shift in how the community perceives your organization and your programs since the name shift?
I think when we have the conversation with them, a lot of people do ask us, why did you change your name to Safe Futures? Or they will not realize that we've changed our name until I see them out at an event and we start having a discussion with them. And then once they think about it, they fully understand why we would have made that change. right? Well, oh yeah, that
That's
really
good,
does
yeah.
make sense, and it's hopeful. It's a
Yes.
hopeful message that, you know, our new name sends out hope for everyone. We want safe futures for everyone, and people understand that. They get that when we talk to them about it.
Right, the idea of being future-focused and not just reactive.
Right. That,
Right.
you know, and our approach is threefold. You know, there's crisis intervention services that we provide. Once somebody leaves the abusive relationship, takes a long time to get back on your feet. So we have, you know, programs to build self-esteem, long-term support to really help somebody keep moving forward. But a third key piece is our prevention programming, education, so that, you know, we want to go out of business one day. We want to become unnecessary to people at some point, and the only way we do that is educating our community and young people, you know, how to recognize unhealthy relationships, how to successfully intervene, where to direct somebody for help, and how do we, as a community, grow in that way.
And how do we reduce the amount of domestic violence that happens in our community overall?
And maybe you wouldn't need quite so many volunteers if there wasn't so much of a need to interact with a lot of people.
That would be the truth, right?
Mm-hmm.
And what we have here, if we can get the what's on the computer on screen, with your name, you have a logo, and
New name, new logo.
and that also, once again, evokes a freer future.
Yeah, we were very fortunate. 9DOT out of Providence did a lot of the work pro bono and continues to work with us to make sure we're evolving correctly.
Now, your headquarters is in New London, and I just wanted to show a couple of pictures. That bench, I actually took this photo off the website because it just was so striking to see that bench. Be not afraid.
Yeah, a donor, we're adding new bricks to our walkway coming up, and somebody who had heard about that campaign got the idea to donate a bench, and that people could, if they needed to wait, either, we're waiting to see somebody inside or waiting for a cab to pick them up, that it would kind of hopefully be a reassuring and comfortable place to be.
And then the front door. Now, I guess we can go now in a little more detail. What would a person do who needed to get help, either for him or herself or for people they know?
Well, I think, it was nice that you showed the picture of the bench and the door right before you asked that question, because when I look at those pictures, it evokes a sense of safety to me, and that's exactly what we want to be able to provide an individual. Whether they're walking into that office for the first time, or maybe we've talked to them on our hotline in the past, we want them to feel safe and comfortable and not, like it says, not be afraid. So our hotline operates 24 hours a day, 7 days a week, and that number is 1-860-701-6000. That's a way that a lot of people reach out to our agency on our hotline. They may be referred by a law enforcement officer. They may be referred by someone working in an emergency room or their own physician. They come to us in a number of ways. But one of the most important things for us, why we're doing this and why we do a lot of awareness, is to make sure that people understand that we're there for them, that it's confidential, that it's a safe place to come.
I think a lot of times people, I'll say to, somebody will ask for advice, and I'll say, oh, well, they should call the hotline and just start talking to somebody. They say, oh, no, they're not ready for that. They don't want to go to a shelter. So, a hotline can be, in our situation, just somebody to talk to, somebody to help listen, who understands, who's, not going to tell you what to do, which is often what family and friends do. Well, you've got to get out of there, or I wouldn't have put up with it. I don't know why you're staying. The hotline is really an understanding person to listen, who then could also provide resources, who, we'll talk you through the process. We know, we don't say you got to get out, we empower people to make choices and put the things in place that they need to feel safe about making a change if they feel that's right. We can help people feel safer in their home as long as they feel they still need to be there. So I think there's kind of a general misconception that if you call a hotline, you're going to be moving to a shelter overnight. And that's not how the process really works. If somebody needs safe shelter, we're on it and we'll get them there. Once somebody calls us, we take that person on, and make sure that they are safe is our number one order of business. But a hotline doesn't have to be used for that.
I think one of the wonderful things about a hotline too, and having advocates that are working on the hotline, is that they understand the nuances of living in a relationship that is not healthy. And rather than coming across as as judgmental, they can come across as hopeful, encouraging. As friends, you often don't know what to say. And yes, like Emma said,
right.
You want to say, you have to leave. You have to do this. But we want to empower them. We want to remind them that they have the answers. They have the answers on their own. And we are here for them. Mm-hmm. Whatever they decide to do, we're here for them to help them.
And sometimes when you're in that situation, you just can't even sort it out.
Right.
Is this, because it doesn't have to be physically violent, which sometimes can be more confusing if you're being just emotionally controlled, and that's maybe eating away at your self-esteem and your self-confidence, so that you start to just get into a pattern where you can't sort out what's really going on here. He's telling me one thing, I don't feel good about this. My friends are telling me another thing. My family's telling me another thing. So just having an objective person who listens and can help you figure out, even if you need help.
Yeah, and it seems to me you mentioned, and we'll talk more about this, that when people leave a relationship, they have to do a lot to be self-sufficient. Mm-hmm. And you can't do that very well when you're in a state of confusion.
No, and it's hard to do it alone. You need a whole support system to get you through. Often an abuser will isolate somebody systematically from their family and friends. So the victim may not feel that they can rely on those people for help. Or, I haven't talked to my best friend in 6 months because he's, jeopardized something with that relationship or threatened me if I do. So you don't feel then that you can reach out to that person for support. So, we're there to provide that support, and we understand the variety of supports you may need. You may very well still have your friends and family and coworkers or whoever to support you, but there's a lot of pieces to put in place.
Now, other than a hotline, what kind of crisis services do people need?
Well, in some situations where they are really in fear of serious physical harm, including death, they can go to a safe house. And so most of the counties in Connecticut have a safe house where someone can go to, and it's at an undisclosed location, so that they can feel safe that that person will not be able to find them. That is one of the most important things that we offer, because regardless of what time of the day or night it is a shelter where they will not be found by their abuser. And that is so important for people. When you think about how hard it is just to move away from your family and friends, but when you're going into a safe house, you're leaving everything behind. Your relatives, you may not be able to talk to them for a long time. You're leaving the school that your children went to, all of their friends, all of your friends, your church family, your neighbors next door. You are leaving all of that behind, and then you are coming to us in a safe house. Maybe eventually someone would go into our transitional living program, which we call Phoenix House, which is when they have been removed from that situation. They're no longer fearing for their lives, but they can't get it together, because like you're alluding to, there are so many pieces that they need to put together. So they can live with us for a couple years in one of those homes while they get their life back together.
And that involves case management, services for kids, placing them in schools and whatnot, and also actively looking for work, figuring out how you're going to support yourself. And we can help people get the training and whatever else they need to be back on that path. While manage, if they're a single parent at that point, how they're managing everything. Transportation is also a big piece that has to be solved. But also in our transitional program, it's not free, but it's prorated. So if somebody pays $30 or $50 a month for rent and utilities, it's an important skill that they need to build. They need to be learning, managing a monthly budget on their own, paying bills on time, putting, money aside, balancing a checkbook, all those kind of things are important to being successful.
And in the safe house, we're looking at coming in with no food, coming in with no
Nothing.
clothing, no personal care items like your deodorant and your favorite cereal and all of those kind of things that you and I get up to and have every single morning. They don't have any of those things. Maybe not a winter coat, maybe not a decent pair of shoes.
Yeah.
And we will get to that later also when we're asking people out there ways that they can help. But first, we have a phone call.
Oh, good.
Hi, thanks for calling.
Hey, it's me. It's Grandma Dot.
What?
Grandma Dot.
Oh. Hi, Grandma Dot. Do you have a
Can you hear me?
question? Yes, we can. But now we can't.
Oh.
Well, it's ironic that it's ironic that you guys started talking about needs just as I was calling. I have to mute the TV. Okay, so
Yeah, you're fading in and out.
Grandma's Attic first annual Christmas party the day after Christmas, and I actually am doing it to give to, quote, Safe Futures. I was doing it, quote, for the Women's Center because that's what people know. And then I found out that the Women's Center had become Safe Futures. Now, you guys are telling us what women really need. Now, expound on that. I would like people to bring those things as needs rather than give money to this Christmas party.
Sure. Didn't you call me a couple weeks ago about throwing your party? I think we spoke on the phone.
And I didn't know that this party,
a couple
there was
months ago, actually.
a link.
Yeah.
But I guess this is as good a time as any, since you talked about what it's like for people just starting out. What are some of the everyday needs that people can help with?
Yeah. The biggest challenges we have are consumable items. Your toiletries, even cards for gasoline, gift cards for Stop and Shop or, that can be used for gasoline. Cleaning supplies, our safe house is a communal living place, sometimes over 20 people living there. So we go through a lot of stuff. The other things, and, because we have an abundance of used clothing. Everybody has plenty of that. But certainly not underwear you need new, socks you need new. Those aren't things that you kind of pass on that are really helpful to us. Feminine hygiene products, diapers. Those are the things that are really a challenge to keep enough on hand.
Blankets sometimes, because every person coming in gets blankets,
Warm
pillows.
things, pillows. We have a program we call Safe and Sound Sleep Sets, which is a laundry bag with a pillow, twin sheet set, blanket, and a set of towels. So we bundle that together. We want everybody who comes to a shelter to feel, symbolically, it's starting over. Your new, clean items for you. It also makes you feel safe. And, okay, it's clean, it's mine, I'm ready I can rest now, Yeah.
Now, you have a lot of information on your website and other places, so maybe we'll talk more, of course, about everything you do, but I want to give people information about how to get in touch with you. So you've got a website, you're on Facebook, you're on Twitter. And I did a screenshot from the website, and a couple things I noticed I kept in. One, there's a Spanish version too, which I didn't look at, but you can select your language. And so I'm guessing, there are plenty of language barriers, but this is one that's less so.
Yeah.
And I see the rapid escape button.
Yes, very important.
Yep. Right. So for anybody who may be going to our website to get information or to explore about the issue that doesn't want somebody walking in the room and finding out what they've been looking at, that'll erase their web browsing history.
And right now, I noticed you had a holiday wish list, which was kind of in the past, but are there still any specific to the holiday things that you could use for people to donate?
We still will need coats for this season. And if people aren't sure, gift cards are a great option. We prefer smaller denominations, $15 or $25, because then it's easier to just give that to somebody for what they need. And gift cards also enable somebody to be taking care of themselves and making their own choices, which is very important as well.
Now, we talked about the crisis support. Now, you help people do more long-term planning as well. What's involved with that?
Well, so it would depend on where they were at in their process, and then also, where they are with us. So are they in the safe house? So that means, do they have necessary paperwork? Did they come here with their birth certificate, social security card, things like that? What is their immigration status? That we may have to help them with that. Then have they identified maybe a safe place for themselves to go when they move on from the safe house? And how will they get there? So do we need to set up transportation with them? Have they not identified? Then where can we help them get to? Where can we help place them in another shelter when they're out of that crisis period? And then, as Emma stated earlier, when they're working with us in the transitional living program, where they're getting employment experience and getting into a new job, they're becoming self-sustaining. While they're there, they get new life skills if they need it. What we do is we put it out to the women who are living with us when we have different opportunities, whether it be an opportunity to learn more about your credit rating, or an opportunity to learn more about different kind of housing programs. We put this out to them. They get to choose whether or not they come to these kind of trainings and learn more about it. And if they don't want to, or maybe they choose to do a yoga class that someone has offered us, which is very good for them because it is going to help keep them balanced and centered, right? So all of these things are available to them, and then us also connecting them with other resources, like will they be able to feed themselves when they move on? Where are they thinking about moving? Those kind of things.
And probably one of the programs where people are the longest maybe are self-esteem support groups, which we have both in Norwich and New London. All our services are free, including the self-esteem support group. And right now we have them just for women. We are talking about starting a group for men soon. But that's where, it's no pressure. There are some people who go every week. There are some people who maybe come once a month or, check in when they're starting to feel a little low. But it's really sharing and supporting each other and facilitated by wonderful, wonderful facilitators who just really keep people moving forward no matter where they're at, and they can come and say, oh, I had a really bad day this week. A lot of stuff was coming up for me. And they have a place to kind of work through that and get back on track.
And they're with other people who have had similar experiences. And when you're healing from any kind of tragedy or traumatic event, you ebb and flow, right? And so perhaps for 6 months you've been going along pretty fine, and then maybe some additional stressors have been put on you, and like Emma said, you're not feeling so good today.
Or something triggered. Or,
so it's always there.
We think like, oh, you left that relationship and good, now it's but emotionally, there's a lot to get through, and things can sneak up on people, and, you can have a real down day like, anything. So having those groups are really critical for people.
Now, how long typically would someone stay in a safe house?
It's no less than 72 hours, just for safety. If you've chosen, that's also statistically the most dangerous time, is that time immediately after leaving. That's when the abuser is really threatened. They've lost control.
And I'm guessing that's when people are making the call and making that decision, when the abuser is out of control.
And then when or sometimes people have been planning and they just kind of disappear, and then the abuser realizes they're gone, and they get on I got to find you, I'm going to hurt you when I find you, whatever. But so if somebody makes that choice to come, they're not leaving right away. That would be dangerous for them. It's we say roughly 60 days, but we also take the stance that we recognize that's, if you've literally walked away, that's not long enough to really get your life back on track. Sometimes people need to just be there maybe a week while the police find him, arrest him, everything goes through, then they can go back home safely. As long as they can financially still manage where they're living.
Everyone's situation is different.
Right. It's different for everybody. But so there's a lot of factors that play. We do not say, hey, it's your 60th day, you're out of here tomorrow. We don't take that stance at all. We know each case needs its own time.
Beneficial.
Yeah. Not when we think of programs as being like that, like, you have X number of days, but it doesn't quite work that way.
Now, for those who transition into a program like a place like Phoenix House, how long can they live there?
That's roughly a 2-year program. But again, we've had people who've moved out after 6 months because they found a place to live, or they got a job and a place to live, or
they had a different level of confidence.
Maybe they came here from another area and they were able to find something that they can move back to, or so again, it's roughly 2 years is what we say the program is. Yeah.
Now, you both mentioned that you would love for this job not to exist. So beyond crisis and beyond helping people plan for the long term, prevention is a big part of what you do. So what sorts of preventative programs do you have, and who are your target groups for them?
So we have a few different kinds of prevention work. I mentioned before being able to work with physicians or behavioral health specialists to be able to recognize it in a family and maybe prevent it from continuing, preventing those children from being exposed to that, doing awareness events. We have a few awareness events a year, like our walk against domestic violence, our hot cider walk that we have in October. We've had it for the last 2 years. And the whole idea behind that is to get people to learn more about what's going on in our community, and that this is all of our responsibility, right? To just get the word out. And then one of our more extensive programs is geared toward students in the schools in southeastern Connecticut. So we have a Violence is Preventable program and a Healthy Relationships program. And the Violence is Preventable program was started 21 years ago.
Wow.
21 years. And it's not delivered, it's not like a one-time assembly program. It's a program where we build a relationship with the students. We're with them 10, 12, 15 times. And we're talking about healthy and unhealthy behaviors. And healthy, what are your beliefs around maybe gender roles? Or what are your beliefs around, what should this boy be playing with? What should this girl be playing with? Or how do you feel when someone tells you can't play with them when they're at a younger level? But as they get older, we're talking about, are you changing your behaviors because you want to fit in with a certain crowd? Or what are you doing if somebody is constantly bullying people? What is your role in that? We really believe that the more programs we have like this, the more we work with these students and help to build that foundation about healthy relationships, the less domestic violence and the less violence overall we're going to have.
A worthy goal.
Yes, and there's certainly there are cycles of family violence. We know that kids who grew up in an abusive home are twice as likely to be abusive as they go. So some of it may be learned, but the reality is there's no one pocket of the population who's more susceptible to becoming a victim of domestic violence or abuse. It's what's the word I want? It doesn't discriminate.
It's
you can be
universal.
educated any socioeconomic level, any ethnicity. So really, by being in the schools, the students really have trusted educators that they can start to explore these issues, and they're facing them through friendships and dating relationships. It's part of relating with other people.
Sure.
It's not just, I think years ago we thought of it, oh, well, that happens within a home and it's behind doors and it's none of our business. But that's not the view we have today.
And if we can help them understand the impact that they make on each other when maybe they're having a bad day and they just lash out at one person, how does that affect all of those people that they're around every day? Does it make everybody feel vulnerable? How can we help them build their empathy skills? Because that's what it all comes down to, is relationships, whether it's relationships with their partners as they mature and maybe get married or have romantic relationships, or whether it's a relationship in a classroom, in the office, at work, at the grocery store. It's all about relationships and being able to understand and empathize with each other.
Now, you start this in kindergarten? Or not
Usually,
quite so young?
We've done preschool before, but usually it starts at about second grade. And the Violence is Preventable, or VIP program as we call it, goes through 8th grade. And then in 9th grade, they do healthy relationships, which we're really talking about the same things, but now we are talking about your dating relationships.
Now, do you find that, well, I guess I wanted to ask, how welcoming have you been, welcomed have you been by the local school systems?
Pretty good. Last year we were in 21 schools, I believe, which is a pretty good number. But there's 100 schools in the county. This fall, half of the year, we've been in 16 schools. So, but it's a case of schools that are having us get it. Or they might try it out one semester and then look at like, oh, did that make a difference in the number of incidences we've had with bullying or, outbreaks? So, Groton has had the program since the beginning for second grade through 6th grade. They've extended now, but clearly they have seen year after year, students are students. But generally this is really hands-on. It's skill building. It's getting up on your feet and doing stuff. Our educators go in once a week, usually in the place of a health class, so it's very curriculum-based, and we get an overwhelmingly positive response for kids. They're hungry to talk about these things. They're trying to figure it all out, and so to have kind of safe people to talk to about relationships is really...
Yeah, and as social media came, into our world, we had to learn to address those kind of things too, because that's how kids communicate. And it's easy. It's easy to bully somebody on Facebook.
And that's become quite the issue, cyberbullying.
Yeah.
And it's easy not to be there to read the broken face when you've said something mean to someone, if you're sending them a text message and not standing in front of them, calling them a name or insulting them. It's a lot easier to get away with that and not build that empathy and not care so much.
Now, if you have a group of students who are in high school doing the healthy relationships, can the people who are teaching that class see a difference if those students have also had the VIP programs from the beginning? Is it a different starting point if you're starting just at the high school level or if they start when they're young?
I would say for the most part, yes. Unfortunately, we don't always have that opportunity
Yeah.
because a lot of the schools will say, we would like our 3rd and 4th graders to have the VIP program. And then the next year it'll be the 3rd and 4th graders again.
Yeah, so you're in an endless loop of 3rd and 4th graders.
Oh, we're having problems in 6th grade this year. Come and do 6th grade. So
it's hard to get that continuity even
Yeah.
with school
Right.
systems that are interested.
yeah,
Right.
Yeah.
But it is a goal of ours
yeah,
to be able to do
to track that.
programs and be able to track that.
Yeah.
Now, also, you mentioned Facebook, and you have a Facebook presence as well.
We have a pretty active Facebook page, I think.
So if people want to get an idea of what's coming up soon, they can go to the Facebook page.
Right. So we do events. We'll also share news, having to do with our issues. It's a great place I found to put urgent needs we may have. Like if we go, oh, well, we're down to our last 2 bottles of shampoo. Let's put on Facebook that we need shampoo. And it's just really neat to watch people share it and, share it and comment and let other people. Yeah.
Okay.
So that's our, and you saw what it looked like.
Right.
So it's we'll share
that's what it
some
looks
news
like.
about client successes and events we have. So it's a little bit of everything.
So now that you've talked a lot about what you do, how can people get involved if they want to be supportive of your work?
Well, the first and best way, what we need to engage everybody in is knowing that this community has this resource, what the hotline number is, where we are. The statistics are terrifying. 1 in 4 women in their life will be abused. 3 women every day in this country are murdered by a current or former intimate partner. The reality is we may or may not know somebody now, but at some point we all will encounter somebody who maybe can use our resource. So if everybody just knows, we have tours regularly. We invite people to come in and learn a little bit in an hour about what we do. Melva runs our volunteer program. So, but volunteering doesn't have to be within our walls, but we do have programs where people can help with mailings, help at events, learn to be trained and learn how to work with our clients. But people can do things across the community, like Grandma Dot, have their own event. We get a lot of support from people. Having a student came in yesterday, their Key Club at high school had done a coat drive. These are tremendous things that really help us and really help us expand our resources. Having your own fundraiser, your own drive, as well as hands-on coming in and do things. And of course,
And there's just a variety of ways to get involved. If you are maybe somebody who worked in human resources in the past and you've done job interviews, right now we're looking for a couple career specialists who can, and it's not, you don't have to give us a lot of time. It's basically whenever one of the individuals that we're working with needs somebody to sit down and maybe go over a resume with them and a cover letter and maybe teach them some interviewing skills, things like that. And again, it could be 2 hours a week. It's not really asking you to come in and commit a lot of hours.
And it's not a regular schedule necessarily.
Right.
It sounds flexible.
It's
yet
very flexible. Or you could do outreach.
Right.
Help get the word out that we're here. Just hand out information about our agencies so that everyone knows we're here for them if they need or if they know someone who needs the services. So there's a variety of ways and a variety of commitment levels there where you can get involved with our agency. And maybe it's just spreading the word. Maybe you're passionate about our work, but you don't have really any time to commit. But you can spread the word about our agency.
Now, are there ways in particular that men who are interested in stopping violence can get involved?
Well, we actually have our annual Men Against Domestic Violence campaign, and we every year try to kind of work and expand, and we have a new staff member who's going to be putting a little focus on that. But we've had a Men Against Domestic Violence campaign for 19 years, so we've recognized for a long time, not only is this not just a women's issue, we won't solve the problem if men aren't involved, right? We have to make it safe for men to talk about it, too, whether it's, how do they talk with other men who they think, don't think their behavior is above board, but also they may be abused. So,
are they positive role models for younger men?
How are you talking to boys? How are men holding each other accountable? But our campaign kicks off in February on the Hall Communications stations, WCTY, NLC, Roxy Radio, WICH AM. And we used to do a one-day kind of telethon thing, people calling in all day. And last year we thought, well, technology, radio, everything's changed. So we shifted to, they promote it on the air. Well, last year it was long, but it was like 10 days or something. This year we're going to do a week, February 2nd to February 6th, where they raise awareness all week on the air, and we'll have a web link where people can also then contribute financially. And we try to keep the messaging and conversations going all spring. And then we culminate on Father's Day with a statement and listing of men who've participated if they want their names included in the Day in Norwich bulletin. So that's very much about raising awareness that there is a place for men, a very important place for men in this conversation, and let's honor, 95% of men have healthy relationships, and it's a very small percentage who don't. So we have a group called Engaging Men that is exploring ways that they can reach out in the community and talk with groups, mentor young men, talk to sports teams. What kind of programs and exercises can they be doing to just have the conversation out in the open?
Right, and part of that is getting some additional training, knowing how to have those conversations, knowing how to make other men comfortable having those kind of conversations is a big part of that. And our umbrella agency, CCADV, the Connecticut Coalition Against Domestic Violence, has designed a program called 10 by 10 that helps to teach men how to have those kind of hard conversations that men kind of veer away from.
Or you think, the most common thing people say is like, oh, if I ever saw him do that to a woman, I'd knock him in the face. Right? Well, that doesn't solve it.
That's not what we're trying to do.
We want to have a more productive conversation. Well, if I was there, I would have punched him. Well, that's not going to really make anything better.
Change.
Right, no. So,
well, before we have to give up this computer, you have some other events that you're going. I know the radiothon is on this, but also you're going to have a presence at some other events coming up.
Yeah, the Bucetto's Bash at the Beach, we are one of the beneficiaries of that event. That's always a good way to kick off the new year. There are some other events. April 1st, we will be having a kind of awareness-raising lunch with a key guest speaker at Langley's in Waterford. We're kind of putting the finishing details on that event. Yes. But Nancy Tyler, we thought would be a good person to bring in to speak. She, if you remember a few years back now, her ex-husband kidnapped her from her office in Hartford. And that whole building had to be locked down. He brought her to their home in Windsor, and it was all booby-trapped with, so it was a big security issue. That whole neighborhood had to be locked down. It involved police from several areas, and a few years prior to that, he had burned down a house that they had in this neck of the woods. So, it's really about how, domestic violence does impact the community, your workplace, your public safety, your neighborhood. All of it can be involved, and that's why all of us need to be involved in addressing the problem.
Now, I think we probably have about 5 minutes left or so. Yes. So maybe we can talk a little bit about, some of the facts and figures, I guess, about domestic violence. It seems, you mentioned that you provide services to thousands of people every year. So, what's the big picture?
One thing is that this number changes occasionally, but a couple years ago, the census of the homeless came back with 60% of homeless families attributing their homelessness to domestic violence in southeastern Connecticut.
Whoa, yeah.
Now that's, and when we have that reaction of, oh, if it was me, I would have left, or if it was really bad, she wouldn't be staying with him. We can't ever guess what reasons keep somebody in a relationship, but
That's a good reason,
if
right?
you leave, the reality that you may become homeless because maybe you can stay at a hotel for a week or you can sleep on your friend's couch for a month. But what do you do,
Right, and that doesn't feel like a really safer choice for you.
No, right. So it's a temporary solution, but you gotta, once you've made that move, you've gotta keep working through. So
Another thing is that we often hear, it's not a reality for some people. They read about it in the newspaper, but it's not really a reality. It doesn't happen, or it happens because both people want it to happen, and they wouldn't be in that relationship if they didn't want this to happen. But in reality, just in the state of Connecticut last year, we served collectively, all of the domestic violence agencies, over 54,000 individuals. That's what we're looking at. And every year in the state of Connecticut, we lose a number of victims. 16 victims are fatalities. And when I talk about that number, that is the number of the victims. That doesn't include the suicide that may have happened as a result of that abusive relationship. It doesn't include the children that may have died as a result of that. It only counts the victims. So the numbers are really huge. They're too big for me, to want to think about.
yeah.
Now, what kind of, now often there are children involved, so even children as survivors, what kind of services are they likely to need?
A lot of the same emotional and healing recovery. I mean, they needed safe people to talk to and people that they can trust and sort out their feelings. They need to know there's an option to not be violent. That just because they witnessed in their home their father behaving a certain way, that isn't the way you have to react or behave. And if you don't like that, let's talk about how you can, it's similar to the VIP, really.
Sure.
It's those ideas. It's, if you don't want to get angry, what can you do instead?
And then of course, they may have medical conditions or they may need therapeutic counseling for any amount of time. When a person goes through trauma, it can often have not only those psychological effects, but because of the high stress level, it may have a lot of physical effects as well. So a child may also, develop some kind of illness or disease that could be chronic for some time because of what they have been through, or they may have been physically injured themselves.
Now we have 1 minute left, so in the last minute, can you let people know if they want to be supportive of Safe Futures, what are the best ways they can get in touch with you or get involved?
Yeah, I would say go to our website, and there's links to donate, links for wish lists. We have a registry on Amazon. There's a link for that, so you can purchase things that we need for the shelter. You can call me up at extension 203, and I'll be happy to talk with you.
And you can call me at extension 212. But one of the things also that I'd like to mention, if you're interested in learning more about what we do every day, consider coming to a tour. And you can call Emma and say, hey,
Yep.
I'd really like to learn more about what you do. Can I join you for a tour?
Yeah.
How often do you do tours?
A few times a month.
Yeah,
Oh.
and they'll be on our Facebook page for the January tours. Those will be going up soon, so, yeah.
Well, thank you so much for coming on. I hope you have a lot of phone calls over the next week. And for everyone out there, next week, Joanne Sheehan from Voluntown Peace Trust will talk about some of those things that are going on and could use support. And in the meantime, thank you for talking about Safe Futures, and good luck.
Thank you so much.
You're welcome. Glad to have you on.